It is just a huge honor for me today to be podcast interviewing Dr. Dominik Nischwitz. Dr. Dom is specialist in biological dentistry and ceramic implants, founder of the DNA Health&Aesthetics Center for Biological Dentistry in Tübingen, Germany, near Stuttgart, founder of Bioaesthetics, which is the company for hypoallergenic, vegan, or organic supplements. He is the current vice president of the ISMI, International Society for Metalfree Implantology. He is expert in the field of nutrition, micronutrients, oral and intravenous orthomolecular medicine, as well as the inventor of the food design concept and the perisurgical orthomolecular supplementation protocol called Bone Healing Protocol. Besides being a surgeon, he's a naturopathic and functional medicine practitioner, as well as international speaker. Thank you so much for joining me today. It's 8 o'clock in the morning on a Saturday here, Cinco de Mayo. What time is it there?
It's 5 p.m. already.
5 p.m. So have you ever heard of the holiday we're celebrating today, Cinco de Mayo?
No, I didn't know that.
Yeah,
Cinco de Mayo?
The United States borders Mexico, and we have 50 million Hispanic people, and they're a very big holiday in the United States is Cinco de Mayo, when everybody eats Mexican food and drinks tequila.
Nice. That sounds great, man.
So you wish you were over here to it. Now, is Mexican food and tequila, would that qualify as any of your nutrient recommendations?
Yeah, Mexican food kind of can, tequila not always.
So what is biological dentistry, and how did you get started with this?
So biological dentistry is, in my opinion, the next level of dentistry. So this is more, the classical dentistry is more like, I would say, manual labor focused, and the biological dentistry takes into concept that the overall body, so the health of the overall body, meaning that the mouth is like the mirror for your overall health. So in terms of, normally in dentistry you're just trained as a craftsman, can I say that? And you don't really check for toxicity of metal or of materials or of any kind of interference you may be producing in the body. So what we do is we try to do, of course, the perfect manual labor, but on top we are trying to get the patient as healthy as possible, meaning we take out all the oral interference, which is nowadays basically all metals, all root canals and cavitations, if you heard of them, like chronic silent inflammations in the jawbone, mostly leftovers from wisdom tooth removal or from just any removal of teeth without the right precautions. So you could say it's the combination, or it's a holistic combination of the high skilled dentistry and the overall health concept, naturopathic functional medicine style. Because I was trying to go a little bit away of the holistic approach, because it was in Germany, it has a little bit of a bad rap to it because it's not too consequent. And what we're trying with the very consequent biological dentistry is implementing high-skilled procedures, which you can see on all the cases I'm presenting. This is ceramic implantation. This is high technician stuff, and on top is the naturopathic or the overall integrative medicine stuff. This is very important because most dentists, they don't understand it at the beginning, talking about immunology, about toxicology, about all these concepts. But if you can show them, wow, what we're doing in terms of just functional stuff, like the ceramic implantations, the immediates, and that it's high-end manual labor, plus on top the next level, so we can kind of squeeze in this concept. And being very consequent and having solutions nowadays is very important, because the epidemic of this generation is mostly chronic disease. It's not emergencies. Emergencies are totally covered by any hospital, but all these chronic stuffs like autoimmune disease or neurological problems, you name it, there are like 19,000 different diagnoses nowadays. They are more like you need an overall perspective on the whole body in order to treat it. And a lot of times the the stuff that blocks the whole system from getting healthy again is the oral cavity with all the stuff placed in there, like different metals, which is leading to batteries, or just any allergic material. Could be composites, could be everything actually what the patient doesn't tolerate. So for us, it's very important to use stuff that is as biocompatible as possible. That's, for example, why I'm only using ceramic implants and not titanium. And the thing is with the biological dentistry, or you can also call it environmental dentistry, which is also the base of it, is that you don't learn this in university. So I was searching for this concept, would probably say all the time while I was doing university, didn't know it back then. And the dentists, they're just lacking the information because you don't get trained the way this works. That's why we have a full curriculum in place now. It's a full concept, so it's pretty easy to learn, but to develop it, it took me a while. So I'm a dentist since 2008, and I'm interested in the field of nutrition and I would say performance or health for the overall body since I'm around about 20 years old. And I was always doing these nutrition things, like trying to do everything to get my body as healthy as possible. Parallel to university, didn't even know back then that I will need this at one point or it will help me with my patients. It was just for me to get me as healthy as possible. And I learned a lot about the micronutrients, supplements, and diets. I tried basically everything you can find out there. But after university, I was at the surgeon because you have to do 2 years of assistancy after university when you're in Germany. And I had the fortune to work with a very great skilled surgeon. He was still doing, for sure, titanium implants because it was 10 years ago. And he was also practicing as a regular dentist. And he was still placing the amalgam fillings, the black ones. And I knew from the university that I think they're ugly. And I also knew from my dad, who is also a dentist, that he doesn't place amalgam fillings for, I would say, since 1990 or something, because they are not healthy. I didn't know about that back then, because in university you don't get trained like that. You only hear, okay, amalgam fillings are very great. They last for a long time and they're easy to do. And they're only not acceptable for pregnant women and kids and somebody with an allergy, but besides that, it's fine. So I told my boss back then, sorry, I can't do the amalgam fillings, but I will bring in the composites, I will bring in the ceramics. And round about at that time, it clicked for me. So everything I was doing in surgery, in university for the diet, the supplements, the biochemistry, and now this new field of the overall body, with the heavy metals, it started with heavy metals and how to detoxify those and what to do instead. This kind of, draw me into it and make me like a little bit of addicted to all this information. And I try to find everybody in the field who was already doing this for 30 years, like Dr. Dietrich Klinghardt, and had great mentors. So this is how it all came along, kind of at the beginning. And at the last semester in university, I was still telling my dad, I'm not sure if dentistry is the right thing for me. I know I like the skills. I'm very skilled with the fingers and I like the practical stuff of it. But something is missing. But then it clicked and I searched my way through it. It took me 5 more years to get the whole concept. And also at times I was thinking I will probably will be a consultant for functional medicine or helping people to find the right way, how to treat get their body healthy. But there were some patients where I could help with removing root canals or some ideas, some cases where we had like major results for the overall body. And at one point it just clicked that dentist is actually the spot where I have to be, and it's probably the right thing. So I learned millions of things and flew around the world everywhere just to learn as much as possible. I'm neurotherapy, I'm a naturopathic doctor, and all this stuff with the diet, nutrition. That's all my journey. And actually, at the beginning, to help myself getting as healthy as possible, because as a kid, I wasn't as healthy as possible. I was a very athletic kid, trying to be a skateboard professional, but I didn't make it back then because I was like having throat problems, tonsillitis, like minor things, but I couldn't reach my full potential. This was one focus for me. So in order to, when I, over my own journey, so I learned all this from my body. So nowadays I can just give it back and spread the word as much as possible. So that's why it's awesome to do the interview podcast with you, because as I see, you have like a huge audience, and I'm very honored.
The honor is all mine. When you say holistic is not very popular in dentistry, were you referring to the 83 million German population or to the 93,000 dentists? Because in America, I agree, there's 211,000 Americans alive today that have a license to practice dentistry, and
Wow.
they think holistic is quackery. But the people, the 325 million people, that they're endorsing it more and more every day because they don't trust big pharma anymore. They go to the doctor and say they can't sleep, they give them Ambien. They say your cholesterol's too high, they give them a statin. They say they have erectile dysfunction, they give them, what are you on, Ryan? They give them Viagra or Cialis, and they're starting to realize that every time they go to the MD, they just give them a prescription pill, which is big pharma. And what's funny is the dentists, they always say they think holistic is quackery, but when they get sick, they're the first people to reject big pharma, and then they try to go fix out, like, why do I have high cholesterol? Can I treat it with diet and exercise? So again, the question is holistic taboo amongst your 93,000 dentists or the 83 million German people?
Okay, you totally got the point. The dentists are the guys who are saying it's quackery. For the German population, it's exactly the same. This is what I call the new health movement. This is people who are taking now the responsibility for their own lives and their own health, because then they don't see big pharma doing any good anymore in these cases. So the people out there is exactly the same as in the US. They're very, very, very interested, but they actually don't know. So this is my goal, to just spread the information as far as possible, just to inform anybody of these new concepts, because I'm doing this for 15 years already, and if you know me, I do everything very extreme. So I know the solutions now, a lot of them, just to do this, and in order to not just take the pill and the prescription, because this is last century stuff. We need to do solution style based dentistry or medicine. With the new health movement.
They get the totally wrong message. I mean, you talk to them in the office, and they wake up for breakfast, have a cigarette and a cup of coffee, and then at lunch they eat at McDonald's. Then after work they go to happy hour and drink liquor, but they're depressed. So before they go to bed, their physician has given them a little blue pill to take before they go to bed because they have depression. It's like that little blue pill can't get rid of a whole day's worth of bad decisions of sleeping and eating and no exercise.
Exactly. That's the point where I'm coming in. I would say this is where the tools are come in, to just train people actually to appreciate their lives and give them tools based on the food design concept, which is actually just the basis should be your diet. Yeah, I call it food design because I don't like the diet word in Germany. The diet word is pretty negative. In the US, I know all the books that are called diet, so you use it differently, the word. It's coming from Greek, so in Greek it's just dietas, meaning healthy lifestyle. In Germany it's more like diet means, oh God, I have to count calories, and I need to be like in shape in 4 weeks for summertime just to be nice and healthy. But after that, I just go back to my regular food, like what you said, wake up, eat some crappy food, smoke a cigarette, drink some coffee, go to McDonald's. It's the same in Germany. But there is this new movement where the people are trying to find solutions. And a big part of this is the dentistry, the biological dentistry, and to inform people. But of course, it's also like your lifestyle, which is food, which is diet, which is also micronutrients, supplementation, which is movement. Like I wake up every day at 4:30 a.m. I wake up, I go immediately to the gym, train, work out, have my me time actually, and take pretty good care about my body. Then I have 2 kids, like 2 little sons. The one is 3.5, the other one is 1 year old, Max and Carl. And I have a wife for sure, she's Steffi. So I need time for my family afterwards, and then we do a healthy breakfast. And after that, I go to my office, which is the DNA, and my nurses start at 8 a.m. with all the IV stuff, because every patient gets an IV up front with micronutrients. It's a standard IV I invented in my time as I would say assistant doctor. I'll tell you later. And this is what the pre-treatment is on day of surgery. And I come in at like around about 8:45, and surgery starts at 9, and I'm doing all day long surgeries with maybe 15-minute break in between with a little snack or like a good food for my body. So you see, I need to be as energetic as possible, and I can't have any drops or like postprandial, post-food like tiredness. I don't know how wording this for this in English. If you're like tired after food, which is pretty common. I'm not tired after food. I'm energetic. So my goal is to be as energetic as possible, being on high performance level. And at the end of the day, I need to get tired and sleep the whole night, and don't wake up, and wake up in the morning 4 a.m., 4:30, fresh. So in order to do this high performance lifestyle, you have to have a lot of tools and tricks and I would say biohacks, just how to use your body or how to train your body to do things like this. This is a lot of the concept. And all my patients, they're coming in from, you just name it, they're coming in from across the world. I don't know how they find me all the time, but I only do remote or virtual planning. So they have to send in the current panoramic x-ray, the medical question symptom. They have to send in their current vitamin D3 levels and their LDL cholesterol level. And then based on this one, I will make a full treatment plan, and you get an email with all the links to my YouTube channel so that they totally informed. They also know like a rough estimate what it's going to cost, and they know exactly how to get their vitamin D3 level as high as possible, because we need at least 70 nanogram per milliliter, which is above the average, and better 100. And I have to change their lifestyle. And the food design concept is a little manual. It's only 15 pages and some charts. And I'm doing an application right now. It's also the food design, so it makes it even more easy. So they get their whole lifestyle change already. So they have to start this, I would say 4 to 8 weeks prior to surgery. They already start with changing their body, because when we do an all-in-one case, that's how we call it. If you remove all metals, all root canals and all cavitations in one sitting or in one sequence, could be like Monday, the metal removal under all special precautions you can imagine. Then on the next day, maybe is the IV or another something dental-wise, and then on 30 is maybe the surgery, which is my part. I'm only doing the surgeries. And you can imagine if there's a guy who has 4 big cavitations and he has like 12 root canal teeth, and I want to replace them with ceramic implants and put a temporary on top. This is like driving a car with 300 miles per hour, and you need like the perfect brake system and everything to not slide out from the route. And this is why you have to be very careful with the overall health of your body, because, for example, ceramic implants, they totally osseointegrate differently than titanium implants. They only osseointegrate in healthy bone and system. So that's why it's so important with the lifestyle. So you see, we do a lot of lifestyle, a lot of food and nutrition, micronutrients, intravenous stuff, neural therapies. It's a huge concept, and now we're able to, all these dentists from all over the world can come in and do the curriculum and simultaneously translate it. So we're trying to really, really change the way how dentistry is done. Just to next level. It's just next level thing. There's nothing from the old stuff is bad. It's just improving it. It's evolution. If somebody from the dentist, if I do a speech like this on a regular dentist conference for guys who are not interested and have no idea about what I'm talking right now, the only way they can react is denial and anger. So they say, no, what is this guy talking? That's bullshit. And then they hate on me and get very emotional. That's why I stopped this a long time ago. And I'm only giving seminars for people that are interested in helping people as much as possible with the right dentistry or with the right approaches. And that's actually a huge number of dentists who grow there and are interested, because they saw like dentistry is like kind of stopped. You can do a curriculum for endodontics, you can do a curriculum for prosthetics, you can do a curriculum in everything. But basically, this is just the stuff you learn in university, and it's just technique and tricks and skills. But if you could help your patient getting healthy again, what you talked about earlier, getting his depression go away, getting his chronic back pain go away and neck pain, getting him energetic, all his chronic stuff, get this stuff away. This is the fulfilling part besides of the high-skilled manual labor, which is also great achievement stuff. But the fulfilling part for every dentist should this be. And I explain it for the dentist who is not familiar with all these concepts. If I am an iPhone, I am iPhone 10, having all the new updates on it. If you're coming from university, you may be an iPhone generation 3. So your app can't communicate with my app because you're just missing updates. And I give you the updates on the seminar. What is immunology? What is toxicology? How does the immune system work? What is an innate immune response with TNF-alpha, interleukin-1 beta, and so on? And if you know all these things, then it's nothing about its quackery and woozah. This is just scientific-based dentistry. That's nothing else. The information doubles every 6 months. You have to read a lot of PubMed to do all this. And normally, Big Pharma also sponsors all your dental magazines. So you probably won't read about this in your dental magazine. And for sure, you won't read about it in university, because university is just the entrance card. If you don't do the entrance, you can't do the dentistry. But afterwards, this is when it all starts. You're not done after university. You're never done. It's like a continuous improvement. That's actually what I love so much. I can do like baby steps every day, getting a little bit better in order to help as much as possible.
You know,
yeah.
The smartest scientist, inventor the United States ever had 150 years ago was Thomas Edison. And he said, my favorite quote, "The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition."
That's what Thomas Edison said?
That's what Thomas Edison said. And he had 1,900 patents, invented the phonograph, the motion picture camera, the light bulb. I mean, this was the smartest guy that ever walked in America. And that's what he said 150 years ago. The doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. I want to ask you the most controversial thing about what you say, because this is Dentistry Uncensored. So I want to talk about the most controversial. The United States has 4,593 endodontists who on average do 8 root canals a day, and you're out there extracting them. Why are you extracting root canals? And do you no longer believe in root canals? I mean, do you think a root canal is not a treatment and all the root canals that are done should be extracted?
Okay. I get this question a lot because I wrote the article 5 years ago about the root to disease, I called it. It was actually published in Dental Tribune and in the Endodontic Tribune also. And yes, my opinion is this: the root canal shouldn't be a medical treatment. It should only be like it was in the beginning. It's just a symptomatic pain treatment. In order to get the pain away, because the patient had like a huge cavity and massive pain, you probably need to do a root canal, but it's totally enough to just place the medication and clean the root from the inside and let it stay there. But over time, this is just, you're just leaving a dead tissue in your body. No medical doctor would ever leave any dead tissue in the body. This is just the craftsmanship dentist who leaves that, because the only thing he believes teeth are doing is biting. And okay, in order to bite, a root canal is totally fine from a mechanically point of view. But but you have to look at this from different angles. You have to check the immunology response of your body. You have to check the toxicology and the allergic versions, and also the mechanical problems. Actually, I don't want to quote studies and stuff. I could send you all my.
No, I wish you would post the art. Dentaltown has 250,000 dentists from every country on earth, and it's a message board for them. It's not like Facebook and Twitter and Instagram where it's just a endless news feed. We use the message board bulletin system. So it's got 50 categories. It's got root canals, fillings, crowns. So I wish you would go to endodontics and start a post and post all that stuff there. And that way everybody there could discuss it, ask you questions, etc. That'd be a great format.
Yeah, that's no problem. Maybe sometimes it's a little bit of a time issue for me, but if that's simple, can totally post it. Or if it's also possible, just give it to you or Ryan and they post it.
No, I want you to post it.
Okay, yeah, I can do that.
Because it's so organized. It's not like having a daily post on a daily news feed. Like, all the social medias are just news feeds, like MySpace, Friendster, Facebook. But this is organized, so you could post it there, and some kid listening to this podcast 5 years from now could go there, go under endodontics, and find it in 1 second.
That's perfect.
Yeah.
Yeah, I can post all the articles there, and on the article, on the back page, I always add in all the research. So there's a lot of research going this, and I had the same speech on a regular podium once. In front of the podium director was the professor for endodontic treatments in Chemnitz, Germany. So his whole life is based on endodontics. And I gave him the full speech about immunological problems, about toxicological problems, about the mechanical problems. And I showed all the studies that they are, by the way, done by the endodontic company, not from me. And then he was saying at the end, yeah, man, you did a great job and you actually explained it very well. But now I'm missing the research or the study why this symptom is connected to this. And it's like a push question actually, because then he just didn't get how the system works. And this is the problem with the dentist. So I'm happy to inform and do this. And I can just recap that really quick. So you have to see the root canal is a treatment against pain. It's a pain treatment. It's perfectly fine. You have to do this because otherwise your patient is suffering from massive pain, or you just extract a tooth. But there's a big but. I don't extract a tooth first. Only if we have a plan, because the tooth is always stabilizing the bone and tissue. So this is always better than extracting it first. So then you have the mechanical problems. You just actually cleaning the one or the two or the three big roots, like the big root canal inside. But you can't actually mechanically clean all dental tubules. It's just not possible because you have per millimeter, per square millimeter, you have like 30 to 75,000 of dental tubules. If you add in the dental tubules from one root, only one root, it's around about a 1 kilometer. I don't know what it is in miles, like 0.7 miles probably, 0.6 miles. So if you have three rooted tooth like an upper molar, you end up having like a 2 mile street for bacteria. So you're not able to clean it. Maybe when you're a very skilled endodontic professional, you can maybe sterilize the tooth for a few days, for half a year, maybe also for a year. But over time, it's just natural that the bacteria that live in your oral cavity, which is around about 400 different strains, they just come in there because they're polymorphic. They can just go into the dental tubules. They're also already in there from doing the root canal. And also there are studies showing that if you don't have a pulp anymore, you don't have any immune system reaction, you don't have any autonomic response reaction anymore. So the pulp is not able to fight against bacteria. So it's now the perfect cave for bacteria. And if there are bacteria, which is mostly anaerobic bacteria, in your root canal tooth, then if you are still healthy and have an immune system, you will have at least an innate immune response, which is just macrophage activity. So macrophages just accumulate, kind of like a cat and a mouse inside a whole lot of bacteria, and the cat is just trying to eat them or play with them. And that's how I explain it. That's the only way that the body can protect itself is by building one thing. This should be connective tissue, which is mostly a cyst, or the other version is it makes a wall. This is called an ankylotic tooth. If it's like a what is it in English? So if the bone gets like super dense and it's kind of like a new body outline, so the tooth is kind of outside of the body, this is ankylotic. Every of you dentists who are surgically practicing know that these are the baddest teeth to remove, because you don't even recognize the periodontal gap anymore. It's just kind of like there's no real difference between the tooth and the bone. So it's also pretty difficult to get it healthy again. So you have the response from the macrophage. The macrophage just eats it and presents it to the immune system. It's doing it by TNF-alpha. This is a cytokine, interleukin-1 beta, NF-kappa B, IL-6. Just cytokine response. It's just regular. The macrophages do it for everything, also with food. It's nothing special. It's just how your immune system works. And then you have a cyst. And it's even going as far you can imagine. I have patients coming in with the biggest cysts ever. And the only question the dentist is asking is, do you have any pain? And of course they mostly don't have any pain because it's chronic. It's a silent inflammation. And then they just leave it because you see it on the x-ray, but it's no pain. Which chronic disease is connected to any pain? Does diabetes hurt? Does blood pressure hurt? Does depression have any pain with it? So pain is an acute symptom. We're only treating acute symptoms in dentistry. This is the way we have to change. We have to change to see the chronic problems are the problem. Yeah. So the stuff that is under your body's already used to. So if it's chronic, it's kind of like your body being a little bit lazy. Yeah, you already accepted this and twisted down the receptor, so you don't have any pain anymore. You're just tolerating these things. Your body's able to do that. He's able to upregulate receptors and able to downregulate receptors in order to be lazy or just go with the flow. And also you have, besides the mechanical and the one immunological problems, you have also some people are very allergic to the root canal fillings, like the gutta percha or the peruba balm, which is in there, or the coliformium, or just the sealer, which is sometimes containing also heavy metals or silver or stuff like this. Could be a problem for the patient. And now another thing is the toxicity. If there's bacteria living in the root canal, which they do, then they have a metabolism. And they just eat the same amino acids that you are indulging every day as a patient. And these amino acids, mostly the sulfur-containing amino acids, they metabolize to some very sick volatile sulfur compounds, which are called thioether and mercaptanes. There's a lot of studying about this. This is like very bad gassing out of these root canals. And this is what your detoxification has to take care of. So you're now having the immunological problem, maybe also an allergy to the thioether and mercaptanes, which is very bad. And also you have to detoxify that stuff every day. Naturopathic doctors will give you maybe some sulfur stuff like MSM in high doses just to compensate for the root canal and the bacteria in there. But in order to really help getting you healthy again or the patient healthy again, you have to remove the source of it, of course. And that's why we have to extract those teeth. But this is only possible with the right protocols. So we don't go and just extract teeth. We just prepare the patient in order to really heal, and then we remove very gently the tooth and the surrounding inflamed tissue. We sterilize with ozone. We clean it with neurotherapy, clean it with the burr. We use APR membranes. We use a lot of things. So it's a big protocol. It's like an 8-step protocol. You can also find it online. And how to do this in order to heal. And the implant, which is a solution only, the ceramic implant, is only a solution, or it's only, I would say, the bonus, because it's the only intention I'm going into surgery is help the patient as much as possible getting healthy again. And if I'm able to...
I want to... You got some tailwinds. I was born in 1962. That was 55 years ago. And that was the last time the U.S. life expectancy actually went down 2 years in a row. And for the last 2 years, United States life expectancy has been going down. I think we're starting to smell the end of big pharma because the Americans know they spend 17% of the GDP on healthcare. We spend twice as much money as Canada or Germany per person, yet
Whoa.
but our life expectancy is going down. So I think the Americans are starting to figure out that, that there's you gotta focus on more than taking prescription medications. I want to ask you, but this is Dentistry Uncensored. I want to ask you another very controversial thing. I don't like to talk about anything everybody agrees on, but back to titanium. There are some people saying that titanium is not as bioinert as people think it is, and that after you place implants in 5 years, 20% have periimplantitis. At 9 years, 40 to 60% have periimplantitis, depending on the study.
Yes.
And then I always say money is very clarity, and I've noticed the biggest players in implants, like Straumann, sells the most units of implants per year. They bought Neodent, but I also noticed that they rolled out the Straumann Pure Ceramic Implant System. So my question
Yes.
is, my question to you is, do you think titanium is inert and can be used in implants, or do you think that the future is going to be non-metal implants?
Yes, thank you for the question. Very good question. I'm one of the guys for sure that say that titanium is not inert for sure. It's a metal, yeah. And as you said, after 5 years, there are 20% of periimplantitis. And on all congresses, on all implantology congresses, you have at least 2 or 3 lectures only talking about periimplantitis. If you're doing the ceramic implants, you never have any periimplantitis. That's first point. And you said Straumann rolled out the Pure system. Every big company like Camlog, Straumann, they're all rolling out a ceramic implant because it's just the future. They probably don't do it for the health reasons, but for aesthetic reasons. No patient would choose a metal implant, a black one, if they could have a white one. For me, that's great because they're also helping with the health of it. So titanium, there's one guy and actually one woman. The guy is called Volker von Behr. He lives in Berlin, has a big lab. It's called the IMD in Berlin.
Can you find out the IMD lab in Berlin?
Yes.
How do you spell his name? How do you spell his name?
His name is Volker, VOLKERVON.
And he's not a dentist. He's a lab technician.
He's a lab technician.
Okay.
Yeah, he has a big lab, and he has invented the titanium stimulation test. We'll just check your immune system if it's already reacting to titanium. This is actually one thing that is not always just the dentist the bad guy. Because titanium dioxide is actually used everywhere as a coloring ingredient. It's called E171, and you find it in medication, you find it in toothpaste, you find it in your cosmetics, you find it in basically everything that's white. And this is where your immune system gets a little triggered every day. You find it in chewing gum for sure. E171, titanium dioxide, and also in supplements and medication. So this is triggering the immune system. So the titanium question, there are different points. It's again the allergy, the immune system thing. At the moment, they are, so Volker von Behr and Vera Stejska, she's from Stockholm, Sweden, but she passed away this year. She did a lot of research for titanium allergy, actually. She was saying it's an allergy. Volker von Behr at the moment saying it's an intolerance, because he's saying if you screw in the titanium oxide, and this is literature, it's just the particles are going into the bone, and then the same system with the root canal, the macrophage system comes in and just eats the titanium oxide particles and presents it to the immune system and makes the allergy, makes the intolerance. So it's a different, if it would be ionic, so in ions, then it would be an allergy. But they don't have a clear common base right now. But the immune system will attack it. That's why you see it on the periimplantitis. This isn't just your immune system. The macrophage system sending out cytokines all the time, producing TNF-alpha. Google this, TNF-alpha, interleukin-1 beta. They locally activate MMP8. This is metallomatrix kinase proteases, enzymes basically that are normally there to help your teeth grow out of the tissue, but then they get activated through the chronic infection surrounding the titanium implant. And they also activate osteoclasts, which are degrading the bone. And then you're also checking if the patient is a high responder, so if they already get a periimplantitis or stuff like this, like a periodontitis or stuff like this. High responder means he has like a huge inflammation, but a very low anti-inflammation. They say it's genetic. For me, it's more epigenetic because you can genetically bypass that with the food and stuff. And on top of this immunological problem, there's one big thing that you don't learn in university, but this is pretty basic. It's the electrosensitivity with all the electromagnetic fields nowadays. Starting from 95, the cell phone was everywhere in Germany. I don't know how to say it. The cell phone radiation. I don't know how to translate it in English. So, but back since 95, you have a lot of electromagnetic fields, and you have Wi-Fi everywhere. You have the same in the US. It's probably even worse than in Germany, but Wi-Fi everywhere. So electromagnetic fields, and just basic physics, electrophysics or chemistry is just that if you have a metal anywhere, like for a radio station, you have like all these electromagnetic waves. They are coming in onto the metal, and the metal will amplify the frequencies. And there are studies showing if you go on a cell phone and you have the normal absorption rate of this electromagnetic fields going to the cell phone and back to the tower, if you have any metal in, they only tested it, I think, with the piercing, then the waves go to the cell phone, then to the metal in your mouth, back to the cell phone, and back to radiation. And here, the amplification, can I say that, is 400 to 700 fold in all directions. And if you know that your nervous system is also a frequency, and they already measured it around about 2.45 gigahertz, where it's sending, so you're totally manipulating your own frequency. And your body frequency is kind of like chaotic, yeah? But the frequency, if you ever heard the Wi-Fi, it's like, and you don't hear this, but people nowadays, they have Wi-Fi, they live in like buildings with 100 people having their Wi-Fi's on, so they can't relax at nighttime because this is disrupting your autonomic nervous system every day, 24/7, and in the nighttime, you normally should be in parasympathetic mode. And if you're in and have metals in your mouth, you're like in the full zone, you can't even relax anymore. Your body's not able to have an immune system. It's not able to detoxify or remove anything from your body because the nervous system is shut down. This is another update every dentist needs. You have to know what the autonomic nervous system is and how it works in your body. If you know all this, immune system, toxicology, autonomic nervous system, if you have these updates, you totally understand what I'm talking about here right now. Because if you don't know this stuff, that doesn't mean it doesn't exist. Yeah, it's just lack of information. And the autonomic nervous system, pretty basically, you have a sympathetic, you learned it in university, sympathetic nervous system, which is the fight and flight. So if there is the saber-toothed tiger, or there's the examination, then you're like having the dry mouth, you're like sweating, your eyes, your pupils are getting big, and every energy or blood is in your muscle in order to run as fast as possible. This is the fight and flight response. This is just the natural response. But the opposite of this, it's called the rest and digest, which is the parasympathetic nervous system. And also in Japanese or in Chinese medicine, it's called the yin. And there are so many people out there that are chronically sick that didn't have any parasympathetic activity in their whole bodies for the last 30 years. So what they have is no immune system, no detoxification system. They're just kind of basically as zombies walking around, kind of not living anymore because they're in constant stress, in constant fear, inner fear. They did not just run from the saber-toothed tiger; they run every day, every second. If you understand this, maybe one more example is if you have the big examination, you normally don't get sick, but 2 days later, when you're relaxing in holidays, you might get down with a cough or with some fever. This is your stress response going a little bit down, your immune system kicking in from the relaxation and chill mode. If you don't have this, your body is open doors for all the chronic infections, for viruses, for parasites, for bacteria, for all the bugs. And you have to know how to get rid of this stuff in order to get your body overall healthy again, because your body is very, very intelligent. And what we only can do is help your body healing itself again. But if you install like the titanium implant with the gold crown on top and next to it an amalgam filling and 2 root canals and a cavitation, and your whole nervous system, which is also the trigeminal nerve, and with it the parasympathetic nerve, is shut down and blocked because of all this, you're not healing. It's not possible. And there's a pretty big a community of all integrative medicine doctors, and one of the biggest or best guys I know out there is Dr. Dietrich Klinghardt. He was twice a year integrative medical doctor in the US. So he's helping autisms getting back to normal. And guess what these integrative medical doctors said? How much is the oral cavity connected to all chronic disease? How high is the percentage of the stuff that we install as dentists in order to get the body not healthy, in order to be connected to the chronic disease? And what would you guess? What would they say? Integrative medical means they know all the things I'm talking about. It's not just from medical school, they learn more. So what do you think is the oral cavity? How many % does it play a role for chronic disease?
Well, I would guess that the gut microbiome would be a bigger role.
Wait a second, I explained it.
What's that?
But I explain you how this is connected.
Yeah, what is it?
It's 80% and at least 70. So this was everybody. It was like 20 very great doctors who saying, okay, this is at least 70 to 80%. And I tell you how the gut microbiome is connected to this. So here is the entrance to your gut microbiome. Here is actually the biggest microbiome, 400. And if you have any amalgam anywhere in your mouth ever had, the amalgam or the mercury in the amalgam film kills your microbiome. Actually, bacteria that get in touch with mercury, they get also antibiotic resistant, and this leads to dysbiosis further down in your gut. And the gut reacts with an inflammation like your gums already doing. So overall, your body is kind of like built around this big tube, which is the whole intestinal system. But here is the entrance. And if there is everything totally disrupted and the wrong bacteria, like a huge dysbiosis, the same is also in the gut more inside. So you end up having a leaky gut. I'm a functional medicine practitioner, so I learned all this. And this is one point where I would say they're lacking information because they're detoxifying and they're helping restore the gut, and they do the 5-hour protocol and they do the diet. But this is all compensating if you have here stuff that is installed 24/7 and the patient can't do nothing against it besides compensating for it. Because all these roots here, all these teeth are actually just your brain a little bit further outside, like your eyes. There's a huge nerve, it's called the trigeminal nerve. It's actually taking 50% of all the other brain nerves in your brain. And this nerve is able to transport via the retrograde axonal transport all viruses, bacterial toxins, or heavy metals, you name it, into the brainstem and from there in the whole body. So basically, it's overall connection, but this here, the mouth is the entrance to your gut system. So in order to help regenerate your gut, take care of your oral cavity first, or do it at the same time. This is how we do it in our office with the lifestyle changes, with the micronutrients. It's actually everything more together. So we don't just focus on the gut, we focus on the detoxification, the gut health, all your hormones, all the interference are going to take out in order to get an overall maximum performance. I call it a performance matrix, and you need...
Is your performance matrix the same as what you refer to as the oral interference?
No, the oral interference is only one part of it, actually. The performance matrix is like how to get your body as healthy as possible for actually body, mind, and spirit. And in order to get this, you have to see the full body. And we take care of course, we have to take care of all the interference, which is metal, root canal, cavitations, scar tissue, unresolved psycho-emotional trauma. What else? Yeah, all the chronic stressors. Basically, if you can do one thing, remove all chronic stress from your life. That's the easiest thing. But in order to do that, you have to know the tools. Then we take care with the diet or with the food design, we take care of your gut health. So we restore, repair, and reoculate your whole gut. Then we optimize the detoxification system, which is the liver gallbladder system. We optimize removal. And with this, we optimize your brain health, your neurotransmitters, because they actually build in your gut. Yeah, 95% of all your neurotransmitters are built in your gut. So if the chronic inflammation goes away, the chronic stress, also your neurotransmitters will change. So this means if the chronic inflammation goes away, depression will also go away. But not if there's any interference. And then at the end, also because of all this, we're taking care of your hormones. Because if you're in chronic stress every day, because of electromagnetic fields, root canals, what else? You name it, the wrong diet, relationship stress, emotional stress, all the stressors.
When you say relationship stress, you mean because I'm sitting next to Ryan?
Yeah, for example, yeah. No, but this is very important.
Right.
If you could see one major thing, if it's chronic stress, it's the chronic activation of the sympathetic nervous system, which is designed to fight and flight. But if you have this one activated all day long, and I can give you stressors, it's a different world than 100 years ago. You have 400 chemicals to pass your system every day. You're eating the wrong diet. Like basically all you can find and easily obtain to eat is mostly not very healthy. Then you have the oral interference, metal root canal, cavitations. Then you have relationship stress, maybe with your spouse, maybe with your son, maybe with your work. And you have electromagnetic waves like Wi-Fi, all these things. So you see, it's a long list of chronic stresses. And if you can reduce step by step all these stresses, get out of this chronic activation of the sympathetic nervous system and go more into the relaxing parasympathetic mode, which is the yin, then you're actually doing a lot of good things. Because what you do when you're in sympathetic, your body is just producing cortisol, adrenaline, like these stress hormones, and produce energy basically. And for a lot of people that I see, they chronically depleted with this. It's called a chronic fatigue syndrome. It's an adrenal fatigue. Everybody knows this. Everybody has adrenal fatigue symptom. So that's basically your body run out of the production of cortisol because you had to do it too long and too much. So these tiny things on your kidneys called adrenals, which are your powerhouses for the hormones, they just shut down. They can't build it anymore. So then you're like tired all the time and you can't do anything. But in order to regain this strength, we have to see where's all this stress coming from. So remove the stress source first. And of course, you have to change your lifestyle. You have to change your diet. You maybe have to change your job. Maybe you have to go to the dentist, remove all the interference. Maybe you also have to shut down the Wi-Fi at night. So this is just a lot of basic tools, and I like to keep it very simple and make it fun, because I'm not the guy being dogmatic. I love to do good things, yeah. And I can tell you, I was very dogmatic, yeah, with all the things I did, because otherwise you don't learn. But now it's basically giving tools back and telling, okay, what can you do to remove this stress? And then you have to see, if your body produces cortisol, stress hormone, on a daily basis, it can produce sexual hormones because it's the same route. There's cholesterol, which goes to pregnenolone, and from pregnenolone goes to cortisol or to testosterone and estrogen. So one out of five couples can't get children these days, at least in our countries. I would say US and Germany is probably the same, Western countries. And 100 years ago, it was 1 out of 100. So if your body is in chronic stress, kind of like in chronic war zone, it's not relaxed enough to receive a baby, because this is like, pregnancy is the most parasympathetic state you could ever be. So you need to get your lifestyle fixed and maybe work a little bit and yeah.
I want to go to another subject about your food design concept and your bone healing protocol. Is that also something you recommend after surgery to improve the healing of the bone after surgery?
Yes. The food design and the bone healing protocol actually go hand in hand. And it starts based on your current vitamin D3 and LDL cholesterol level. It starts at least 4 weeks prior to surgery. The food design is just my take on a good individual diet. So it's all I learned the last 15 years, and I tried to squeeze it in 15 pages and do some simple charts. It's a green chart and a red chart. It's very basic. It takes me 1 minute to explain it. And we're doing the app for the iPhone right now, so it's even easier. So the patients know exactly how to eat. And then, based on the vitamin D3 level, I have invented a bone healing protocol, which is actually based on very, very high doses of vitamin D3, which is at least 20,000 IUs a day. And in order to tolerate 20,000 IUs a day, you need to have all micronutrients in check, which is basically vitamin K2, all the minerals, and all these B vitamins. You can see nutrients are totally different than big pharma medicals. Nutrients are always working synergistically in a team. If vitamin D3 is, for example, the goalkeeper, and the vitamin K2 is right next to, in the soccer game, in the front to shoot the goal, and you have the magnesium on the other side, then you also need all the trainer staff, and you need the second team on the row outside. This is how nutrients work. So they're all designed to help these chronic patients with their methylation problems, which is SNPs they have due to the toxicity of the metals and the infections from the oral interference. And it helps with the cryptopyruria, and it helps with absorption. All these nutrients. This is I would say I'm a super nerd when it comes to nutrients. I pick them all myself and design all these products, the combination, because I want to have the perfect quality, because this is like food, it's not controlled. So supplements could be the baddest idea or the best idea if you know what you're doing and how you take it, and it's not getting controlled. So that's why I had to build my own company back then, actually basically only for my patients and for me. But it's grown a little bit bigger already, but still tiny. It's mostly for dentists and the surgeries. So this is the 4 weeks prior.
Well, you know, one of the categories we have on Dental Town is health topics, and under health topics, nutrition. You should post this, your 15-page deal, and when your app's coming out. But I want to ask you one.
It's only 15 already. It's pretty tiny.
I wish you would post that under nutrition. But I want to ask you, this is Dentistry Uncensored, a controversial question. Americans are told by people like you that, 10 or 15 minutes of sun every day on your skin is so good for vitamin D and D3. But then the dermatologists are saying, no, that's really bad, and you should wear sunscreen. If you're going to be out in the sun at all, you should be wearing sunscreen. So, is sun bad and we should always wear sunscreen when we're exposed for 10 to 15 minutes? Or is it good and we'll get vitamin D3? It's a very mixed message.
I know it's very bad actually. In Germany it's the same. We had a lot of problems with the doctors at the beginning. So basically sun is the best thing you could ever have. Yeah. Basically we are designed to live on the equator. And that's where all the life started. But now we are living way too high. Not you in Phoenix, Arizona. You probably have sun every day, am I correct?
Yeah.
Yeah, you should go out in the sun, and mainly in the direct sunlight when the angulation of the sun is the highest. When the dermatologist tells you to don't go in the sun, then you should go, because only then the UVB is going down, and then you're producing the vitamin D3. And 1 hour of sun is giving you around about 30 to 40,000 IUs already. So this is more than the little pills you could take. But in Germany, for 6 months of the year, or also in the US, further, if you go above Los Angeles, it's the same in Germany, then you don't have any sun like Seattle or stuff in the wintertime, and you drop dramatically because you need it every day. You're designed to be on the equator, having you 1 hour or 2 hour a day of sun every day and producing every day around about 40 to 100,000 IUs of vitamin D3. So if you have the possibility, of course you should go out in the sun. And if you build your vitamin D3 level high, then you have an integrated sun protection factor, and you can tolerate sun longer. At the beginning, you shouldn't go like fry in the sun for an hour and get the worst sunburn, that's very bad for your health. But if you like dosage it, go with the skin not covered and mostly your forearms like a farmer, and in the main sun like at 12 in the 12 noon, then you get your vitamin D3 level every day, and then I'm pretty sure you don't have to take any supplements. But for all those guys who live above Los Angeles, you need to take the vitamin D3 because you will drop dramatically if you don't get it every day. And the average person in Germany, and I'm pretty sure it's the same lab average of vitamin D3, is 30 to 60 nanogram per milliliters of vitamin D3. So meaning that most of them are below 30, which is, I call it hibernation mode. So your body doesn't do anything. It's just hibernating, and there are a lot of studies showing you that if you just give your level above 30 for women with breast cancer, 50% better. No breast cancer, 50% less breast cancer. If you just have your vitamin D3 level doubled from 15 to 30, which is still basically low. And then you go to the equator where the vitamin D3 level is 80 to 120 in average. And that's just how I want it to be, just in the equator zone, having 80 to 120 IU. So you have to go to the sun for this, but dosage it. Don't go first day 1 hour in full sunscreen if you have like a light skin. Of course, you can do this if you're Afro-American and have like a darker skin, which is actually just integrated sunscreen. But also if you like having darker skin and living in higher altitudes, you need more sun. So you're getting more depressed or having more problems because you're not uptaking the sun if it's always dark. It's easier for people with lighter skin because they don't have so much sunscreen. So you have to know, but just monitor it. Check your vitamin D3 level. It should be above 70 your whole life. That's when the doctor or dermatologist say, oh my God, you're going to die because of the sun. You have to cream against the best thing in the world. So the sun, there are studies out there that showing that if you sunscreen or don't go to the sun, melanoma increases. There's no study showing you that if you go to the sun that you get sun cancer. But there is studies showing you that if you not go to the sun, you get melanomas. It's only the guys who sit inside and don't see the sun ever because they have a hibernation mode.
You said that humans kind of evolved near the equator, and when I was in school 30 years ago, even 20 years ago, all the old hominid fossils were found near the equator in eastern Africa. But Germany just found the oldest tooth in the world, 9.6 million years old. That really turned everything upside down, didn't it?
Yes, I heard that too. It's actually basically close to my city where they found that stuff. And I'm pretty sure that we don't know exactly how old we really are. I'm actually not an expert in archaeology and stuff like this, but I'm pretty sure there will be a lot more information coming out to this. For now, I'm just going with the idea that we evolved around the equator, and hanging around with like just a short. The rest of the body is not covered, and you have to have the sun all day. You can fish and hunt and get all the things. And this is like the Centaurians, can you say? People who live are they called Centaurians?
Yes.
They get an average, they are the blue zones in the world.
Right.
The blue zones, just check the blue zones, like Sardinia or something. They get an average 93 years old, or a lot of them go over 100. And what they have in common, they don't have any chronic stress. They have a lot of sun and the sea. They eat fish. They eat the stuff they find. There are no doctors there, so they just basically relax their whole life and take care of themselves and are in yin mode. So you can just little bit in our crazy society where you have to go on the phone and do these things all day long. And I love it. I have an iPhone. I have an Apple. I have all these things too. I like techniques. You see, I have a nice headphones. I like Bluetooth, but I know how to use it and when to maybe shut it down in order to help my body relax. I'm the guy who performs as much as possible, but I don't want to get sick by doing this. I want to get as healthy as possible doing this. And on the other side, health. Yeah.
Final question. Our format is an hour, and we're already 6 minutes over the hour because you're so interesting. But final question. When you talk about metal-free and removing metals, does that include gold, since gold is a precious metal?
Yes. Actually, no. The gold is always a alloy, so there are a lot of different things like palladium and also sometimes copper and other metals in there. And none of these used materials have any function in your body. And also Volker von Behr presented a study where the LTT test, which is the lymphocyte transformation test, on 1,200 patients, where they just tested the allergy, like a real immune response from the patients to the metals. And on number one is always the nickel for sure. And they tell you that nickel is not allowed anymore, but they still place it in dental materials. Number 2 and 3 was organic and inorganic mercury. And on number 4, and the place 4 was gold already. Because gold also disrupts your system and your macrophage system. So nowadays, it's totally different. 30 years ago, I would say, where no Wi-Fi was there, no cell phone towers, nothing, you probably could get away with a lot of titanium implants and a lot of gold in your mouth. But nowadays, this changed due to the stuff I told you before with all these, the condensing and all these, kind of like basically antennas in your mouth. Yeah.
I want to end on just a. When you mentioned the Blue Book, that's got to be one of my favorite books. Actually, you know what my favorite book this year was? I can't believe I'm going to say it on a podcast, but it made the New York Times. It's called, what was it? The Subtle Art of Not Giving a Fuck. That was, nice. And the book before that was a Blue Book, and I'll tell you why. Just a summary real quick. It says, move naturally. Don't do marathons or pump iron. Walk around the house, garden, walk, cycle. Number 2, know your purpose. Have a reason for waking up in the morning. Number 3, kick back. Find ways to shed stress, whether it's praying, napping, or going to happy hour. And I recommend reading The Subtle Art of Not Giving a Fuck. It was just an amazing review of history of all the smartest people explaining to you to relax. Number 4, eat less. Number 5, eat less meat. Number 6, drink in moderation, but I scratched that one out. 7, have faith. You know what's wrong with faith is when I tell my kids that I'm God, they all become atheists and stop believing in me. So number 8, power of love, put families first. Number 9, stay social. That's why I love Dental Town. But man, I could talk to you for 40 days and 40 nights because you're pushing the boundary. I always tell dentists, so many dentists think that they're pioneers. I say, you're not a pioneer if you don't have a half dozen arrows in your back. So if you're not causing any ruffles, you might be a pioneer in your own mind, but you're not a pioneer. And I can't even imagine how many arrows you've got in your back.
A lot of arrows in my back, man.
Well, that just means you're a pioneer. I mean, what did Gandhi say? First they laugh, and then they turn violent, and then they finally accept you. But thanks for coming on today and talking to my homies from around the world. I hope you publish on Dental Town under endodontics, your paper on endodontics. Yes. I hope you go to health and drop down into nutrition and post that. It's a huge honor that you came on the show today. I think it's so fun that I'm sitting here in Phoenix and you're clear on the other side of the world in Germany and we're just talking like you're in the next room. But thanks for all that you do for dentistry, and thank you so much for coming on the show.
Yeah, thank you so much for having me. It's a pleasure. It was a pleasure. It's still, and it's awesome to talk to you. You're open-minded. I like that very much.
Well, I'm open-minded because if you go through history, you always know what you know, but you never know what you don't know. And once you think everything you know is the answer, well, then you didn't read any history. I mean, the Greeks said there were 4 elements: earth, wind, fire, and water. Now I'm pretty sure they found 93. The book is always growing. And Ryan, thanks for getting up early on a Saturday on your day off and doing this podcast. Have a rocking hot day.
Thank you very much.